Louise V. Batalla from BSN 2A, and in this video presentation, I will be having a return demonstration with regards on how to do the procedures for the Leopold's maneuver. Now, in this video, I will be talking about three most important things. The first one is the basic background of the Leopold's maneuver. What do we need to know about it? The second one is the most important medical reminders that we should know before we proceed with the Leopold's maneuver. What are the things that we need to let our patient know before we proceed to the maneuver? And then thirdly, we are going to talk about the four important maneuvers that are involved in the procedure of the Leopold's maneuver. So in the third part, we will be studying and have a quick learning as to what are the chronological steps on how to perform the Leopold's maneuver to our pregnant mother. Alright, now talking about the basic background of the Leopold maneuver, you might be asking, who was the person who actually christened this terminology? Alright, so the Leopold maneuvers was actually named after the German obstetrician and gynecologist, which is Christian Gerard Leopold. Now, this Leopold's maneuver actually consists of four classical maneuvers, which is used to palpate for the gravid uterus of the mother systematically in order for the healthcare provider to determine the position, presentation, and engagement of the fetus inside the uterus using his or her both hands. Now, this method of abdominal palpation is actually low cost, easy to perform, and non-invasive. So this Leopold's maneuvers is actually very popular and common to every single healthcare providers that we have globally. Now, talking about the most important reminders that we need to have for ourselves as the healthcare provider, and in order for us to assist our client, we have several things. First, we need to introduce ourselves and verify our client. The reason for this is that in order for the client to know us, and in order for us to identify whether we are serving or assisting the right patient or not. Second, we need to explain the procedure and to make sure that the woman or the pregnant mother will be able to void or empty her bladder. The rationale for this one is because we need to explain ourselves in order to reduce our client's anxiety as well as to have her cooperation. We also need to encourage the woman to empty her bladder because this will allow us to have a more productive palpation because the fetal contour will not be obscured by a distended bladder. Next, we need to wash our hands and make sure that we will be able to provide privacy. The reason for us on why we should wash our hands is for us to avoid spreading any kinds of infection to our client. And we also need to remember that we can wash our hands with warm water because this will aid us in order for us to provide comfort, and it will also prevent the tightening of the abdominal muscles upon the palpation or during the Leopold's maneuver. Next, we also need to provide privacy in order for us, of course, to acquire our client's cooperation as well. Next, we need, of course, to observe the woman's abdomen as to which is the longest diameter and where the fetal movement is more apparent. So the longest diameter is actually the length of the fundus, and then the location of the activity must be very determined in order to reflect for the proper position of the fetus. Now, those are the most important things. And then of course, after you do the Leopold's maneuver, you want to make sure that your findings are actually accurate, and you might as well ask your client if he or she has a preliminary scanning. You want to ask her if she has documents so that you will be able to see whether your findings actually have paralleled to the things that her previous healthcare provider has given her. Now we proceed with the third part of this video presentation. Now we're going to proceed with the proper procedures for the Leopold's maneuver. Now again, we need to remember the most important reminders again. So here is how I'm going to do it. Nay, good evening po. Ako po muna ang student nurse ngayon. Ako po si Ana. And ano nga po ulit ang pangalan ninyo?
Winnie.
Ayan, so Nanay Winnie, magpo-perform po ako ng Leopold's maneuver. So wag po kayo mag-alala. Kamay ko lang naman po yung gagamitin ko. And hindi naman po tayo gagamit ng kung ano pang equipment. Bali, kakapain ko lang po yung inyong abdomen or chin. Para malaman ko po kung ano po yung position ng inyong baby. So, Nay, nakaihi na po ba kayo or gusto nyo muna pong pumunta sa CR?
Tapos na.
Tapos na, sige po. Kailangan po kasi nakaihi ka na para hindi po ako mahirapan din sa pagpalpate and para hindi din po kayo maging uncomfortable kapag nagsimula na po ako magpalpate. Pero don't worry po kasi gentle lang naman po yung pressure na ibibigay ko and hindi naman po sobrang madiin. So, ayan. Next thing that you need to do is to lift the client's clothing up. So now we're going to proceed with the first maneuver, which is also called as the fundal grip. Now, the fundal grip purpose is for us to determine the fetal part lying in the fundus and to determine the presentation. So what I'm going to do is I will be facing mom and stand at the foot of my client, and then facing her, I will place both my hands in this position flat on her abdomen, and then I will be palpating the superior surface of the fundus. So in this part, I need to be very careful not to give too much pressure in order for me to determine the consistency, shape, and mobility. So, if the head is what I'm feeling, it should be round and hard, and it moves independently from the body. But if it is in the breech presentation, meaning to say, it feels softer and it moves only in conjunction with the body. So here we will be able to determine whether the fetus is in cephalic presentation or breech presentation. Now we proceed with the second maneuver, which is also known as the umbilical grip. So the purpose of this one is for us to identify the location of the fetal back and of course to determine the position of the fetus. Now, in this maneuver, again, I am facing my client, and then I will hold my left hand stationary on the left side of the uterus, while my other hand, which is the right hand, I will be using it to palpate on the opposite side of the uterus from top to bottom. So in this part, you want to make sure that you are not using deep pressure but only gentle in order for us to not to cause any kind of uncomfortability in our client's part. And then after that, I will repeat the same motion on the other side of the uterus. Okay, so the fetal back, when you feel it, it's like a smooth, hard, and actually resistant surface. But if it's the knees and elbows that you're feeling on the opposite side, it should feel like a number of angular bumps or nodules. So that's actually what you need to remember when it comes to second maneuver or umbilical grip. Now we're going to proceed with the third maneuver, which is actually known also as the Pollock's grip. So the purpose of this one is in order for us to determine whether the presenting part of the fetus is actually engaged or not. So how I'm going to do it? Using my thumb and finger, I will form an L-like position, and then I will gently grasp the lower portion of the abdomen just above the symphysis pubis. There you go. And then I will press in slightly, and then make gentle movements from side to side. Okay, now, if the part that I'm feeling is actually firm, meaning to say it is the head, but if it is soft, then it is the breech. Again, if the presenting part that you're feeling can actually be moved upon your upon the movements that you have made from side to side, and the pressing of your fingers, meaning to say the presenting part is not yet engaged. But if the presenting part that I have felt is not movable, meaning to say it is already engaged. Now we go on with the last maneuver, which is actually also known as the pelvic grip. So the purpose of the pelvic grip is for us to determine the degree of flexion of the fetal head and to determine the fetal attitudes or habitus. Now, so the whole time I was facing the mom. Now for the last maneuver, I will be facing the foot of my client. And then what I'm going to do is to place my fingers on both sides of the uterus, approximately just 2 inches above the inguinal ligaments. And then I will be pressing backward and inward in the direction of the birth canal. And then I will allow my fingers to be carried downward. There you go. So for this part, okay, for this maneuver, I will just be determining the cephalic prominence, and then I want to make sure that the brow should be on the opposite side of back. So the purpose of this one is actually to verify the positioning of your baby. Alright, so we are already done discussing the 3 most important points here in my video presentation. I hope that the explanations and the steps that I have discussed in this video is actually clear, and I hope that you have liked how I presented this video. So that's all for today, and thank you very much for watching.